If you have leg pain, it's definitely worth an evaluation with a vascular specialist. It always starts off with a really good history and physical exam, feeling for the pulses, lack of pulses, looking for wounds, looking at the feet real intensely, make sure there's no skin breakdown. We have tests. We use typically ultrasounds or blood pressure cuff tests we can look at. And then we have things like CAT scans and MRAs that we can look at to see the blood flow. Then we move on to the next stage, which is angiogram. I'd say like 90–95% of the time when we go in there for an angiogram, a diagnostic angiogram, and there's a problem, we can switch over to an interventional procedure and just start fixing the problem there. If there's something we can address safely, whether it be with balloons, stents, drilling out plaque, clearing out the plaque in the leg arteries, that's what we typically do first. Surgery, which is obviously still done a lot, has its place, of course, for really extensive disease or severe blockages in major arteries. But, I think for the most part, when you're talking about PAD, a lot of this now can be approached with endovascular or minimally invasive techniques. And then we want to control other risk factors. So controlling cholesterol, if it's diabetes, controlling the blood sugars, blood pressure control as well. And if they smoke, having them stop immediately. So those are the things we can do to kind of modify the progression of the plaque. As far as helping the symptoms, we typically use exercise for the most part. Believe it or not, in a controlled setting, if somebody exercises to that point of where they feel that discomfort, pushes through a little bit more and rests and then kind of repeats that, over time, the body will actually develop more arteries to kind of help decrease some of those symptoms. And so that would really be our goal, to restore them back to what they would want to do on a day-to-day basis, whether that's running or walking or just going to the grocery store. Those are all realistic goals that we try to achieve.